We wanted to hear your perspective on healthcare, just in general, because it's an issue that has been very much talked about over the past month. And
even longer. Then on May 1st, there was a huge rally in Montpelier.
Right.
The Healthcare is a Human Right rally.
But now we're seeing, Obama giving press conferences and sit-down chats, about the healthcare system that he's proposing, and then there was that big debacle with ABC giving, Obama the limelight and not presenting the other side like they would. But I don't hold that against them because Fox has done that for the past 8 years. But we haven't seen too many details come out yet about the plan. So I'm wondering what your take is on providing health care to a nation of 320 million people.
Well, it really goes back a lot longer ago than you suggest. It goes back for sure to the early 90s when Hillary Clinton unsuccessfully tried to design a national health care system that failed miserably. In retrospect, even though I'm no fan of Hillary Clinton, she may have done the nation a big favor, because I think what she proved conclusively is that that a national health care system, if not politically unfeasible, really doesn't make any sense for the United States. And to put it more bluntly, I do not think that the health care problems of the United States can be fixed at the national level. And why do I think that? Even though I'm an economist, I believe that the problem of health care in the United States is fundamentally a philosophic problem, not an economic problem or a political problem. On the demand side, healthcare in the United States is driven by the fear of death, by a near paranoid fear of death of people living in the United States. On the supply side, it is driven by greed, by the suppliers of healthcare. When greed meets fear of death, the price can only go up exponentially. And until Bernie Sanders, Barack Obama, all of the advocates of national health care come to terms with fear of death and greed and the intersection of those two market curves, we're just whistling Dixie, because whatever they come up with is guaranteed to be short-run, unstable, and will soon spiral out of control.
Okay. So I actually will be starting medical school in early August this year. That's why I'm moving down to Miami and leaving the show,
unfortunately. So maybe you can fix it, right?
Well, no, but do you have any words of advice for someone entering healthcare at this time? And when you say the fear of death, the patient side, and greed isn't necessarily the politician side. There's the physician side as well. There's certainly plenty of physicians. Right.
Oh, absolutely.
So and I'm going to see a lot of that. So and physicians and politicians and patients. So any words of advice for someone going into the field?
I can recall a few years ago, my wife was giving a lecture at medical school students on death and dying, and she turned to them and said, "Death and dying." This first-year medical students, what comes to mind? And they said silently. I mean, the lecture was complete bust. They said nothing, and finally one person spoke up and said, "We don't think about death and dying. That's what happens to old people later in their lives. And here are these young kids about to spend their entire lives dealing with death and dying, and they don't think about it." So my advice would be in medical school, think about it. Mm-hmm. What are the implications? What's going on with the patient? Do you want to prolong their lives forever? Is this really in their interest? I mean, part of the paradigm is that the suppliers say, with modern technology, you're entitled to live forever. You're
Right.
entitled to the state-of-the-art technology and tools and medication that medical science can offer. And if everybody believes that and everybody thinks they can live forever, we're back to the sky's the limit.
Yeah, and that is the philosophy of medicine, that death is really off limits.
That's failure.
Right, and if you look at the cost analysis of medicine, sometimes the last week of a 95-year-old person's life can be thousands upon thousands of dollars when they had some major health complication, and to keep them alive for what turned out to be an extra couple of days or week, which in the scheme of things, perhaps it's arguably shouldn't have happened.
Or to
but
keep
it's an
them
enormous
alive
cost.
to lapse into Alzheimer's disease
Yeah.
for another 10 to 20 years. I mean, every night on the NBC News, nearly every night, there's some major breakthrough, life-saving device or pharmaceutical product, as though this is the greatest thing since sliced bread.
Mhm.
Is it really? You know, is that really best for us, for society?
Mhm.